For me, it kind of reached that tipping point late in the year last year. I was like, all right, I got to do something. I wasn't able to load the joint at all. So imagine, trying to, the obvious ones are like run and jump. But even if I was told to do like a reverse lunge with my right foot, the side that the injury's on, where I step back with my right foot, I couldn't do it without obviously favoring the outside of my foot. 7 months ago, I got the injection. It felt better at month 1, but when I reached the 4-month mark, that's when I was like, man, my foot is really doing well. It has progressively gotten better for the last 4 months, and then at month 5, I felt even better. Month 6, I felt even better. So now I'm able to load it. I'm able to push a sled, off that big toe. I'm able to reverse lunge. I'm able to even run a little bit. Prior to the stem cells, I wouldn't have been able to do that.
Welcome to the CPI podcast, everybody. I got a cool special guest. I don't really know you, but I feel like I know you because so many of our friends know each other, and I've heard so much about you. Josh, tell us a little bit about yourself. Tell us a little bit about and how you ended up here in TJ.
Yeah, thank you, Scott. I appreciate it. For me, I guess I'll tell you a little bit about myself first. I co-own and run a clinic in Brentwood, Tennessee, which is Nashville area, where we do chiropractic, physical therapy, and sports-specific training. It's called Resilient Health and Performance. I'm a chiropractor myself. I've been in practice for 18 years. I've got 5 physical therapists, 1 other chiro, 4 strength and conditioning coaches, and an admin at my front desk. So it's a great team. How I ended up in TJ, it's a pretty cool story. I'll give you the shorter version.
Okay, well, this could be a long-form podcast if you want. So.
Well, I had 2 patients in my office, and they had both been to you guys down here.
I didn't know that.
With great results. And the crazy part is they both came to see me within the same week. Okay. So one guy comes in on, say, a Tuesday. The other guy came in on Thursday or Friday. I don't recall. But they tell me about their experience and what a great experience they had. And they're coming to see me months later after they had given their bodies the necessary time to recover, etc., for some rehab and some other types of body work. And they both shared with me, the first guy was sharing with me his experience and how positive it's been. And I had been to a podiatrist. So my whole interest in all this started with my foot. Right. My first MTP.
Turf toe, right?
Turf toe. Yeah, my first
What
MTP
exactly is
joint.
turf toe for people that don't play football?
It's basically a strain, sprain, hyperextension type injury of the big toe of your foot. And for me, it did happen on a football field, actually. I was just running routes for a friend of mine who was a quarterback coach. Needed some guys to run some routes. I was the only one around that day. So I agreed to do it, and I had the wrong footwear on and, running and cutting like I probably wasn't accustomed to at that point. And anyway, suffered a turf toe injury. Probably, in retrospect, didn't really allow it to heal as well as I should have. Started the sequelae of some arthritic change thereafter. And, well, here I was about 5 years later.
Oh, it's 5 years after.
Yeah,
wow.
and my foot had continued to get worse and worse, but it, I guess everybody kind of reaches a tipping point or a threshold where you're just like, all right, I've got to do something about this. And for me, that happened around October, November of last year. So I had met with 2 different orthopedic surgeons in Nashville. I was thinking I'd just go in and maybe clean up the joint. And, well, I wasn't pleased with what I was hearing. I mean, one guy even looked him in the eye and I said, are you sure you're talking about my foot here?
Wow.
The process and the procedure that he was describing. So that definitely turned me off from that route. So then I went to see a podiatrist, this young, bright, sort of progressive guy. And he, upon looking at my imaging and everything, he said, hey, you're a great candidate for stem cells.
Oh, wow.
I could do a minor surgery on you, but I would recommend you try this route first. So I basically said, all right, I'm game. I'm in. What's next? And he said, well, I'll call you when I get these cells, and I still haven't heard from that guy.
Oh, you're kidding me.
I still haven't heard
Wow.
from him. So, well, that was, I can tell you with I mean, I remember these dates. I'd gotten an MRI December 3rd of last year. I saw him on December 8th, which is a Thursday. And I had this encounter with those two patients right after the new year, so early January. So back to the story, second guy comes in on Friday, and he starts sharing me with me his great results too. And now I'm like, man, I need to find out like more about this place. And, I'm going to go there and get the stem cells perhaps, right? So they tell me about CPI, and they tell me just, again, can't say enough good things. So the very next Monday, another guy comes into my office.
Another one.
Another one. And he...
Do I get a kickback for all these clients or what?
No, he has not been to CPI.
Oh, okay.
But he knows Ed.
Ah,
He's
okay.
been long time friends with Ed. So Trey says to me, we're talking about the weekend, and he says, yeah, I had a fun weekend. I saw a friend of mine who is in town. He's going back and forth. He spends a lot of his days now in Tijuana, Mexico. And I'm like, this is like eerie now. So I said to Trey, I said, hey, are you talking about Ed Clay? And Trey looked at me like I was, had 1,000 faces, 1,000 heads. He was like, how did you know?
Yeah.
And I'm like, man, it's just, I knew I had 2 encounters last week and blah, blah, blah. So I said to him, Trey, I said, hey, can you please do me a solid and introduce me to Ed? So as soon as we got done, me working on him, he texts us both, and Ed texts back, and he says, hey, if you're available tonight, give me a call. So I called Ed. We had a conversation. I explained my foot, explained how long it's been bothering me. And I think at that period of time, perhaps you guys didn't have a whole lot of experience with my type of injury. He was like, let me check with the doctors, and I'll call you Wednesday night at 7. Right. And, I didn't know Ed. And I was like, okay, let's see if he calls me back. So 7:00 Wednesday night, my phone rings. And before I even answer, I'm like, well, this is a great sign. This guy's, true to his word. He followed up. So we talk, and he's like, hey, I talked to the doctors. It's a go. Like, they really think we can help the injury, and, when can you come, sort of thing. So I ended up coming down here the last week of February, earlier this year. And that's how I ended up in TJ.
Okay.
So,
well, I'm glad you explained that to me, because for some reason, I know that Ed knows all the football players and stuff, and I know that you work with a bunch of the pro athletes over there, what you were doing. So I thought through like Eli and Ed, the Titan guys are always over at Ed's house and stuff like that. So that's how I thought you guys actually knew each other. I didn't know that you guys had known each other such a short period.
Yeah, just a short period of time. Yeah.
Oh yeah. And I can think of 3 turf toes that we've done, but they've all been, the other 2 guys were from jiu-jitsu.
Okay.
Guys get their toe caught in the mat.
Yeah.
And then I guess it does the exact same thing from it, but we could have more. I got 32 people here this week, man. It's hard to keep up with everybody.
Yeah.
That all the stuff that they're doing. Well, that's really interesting, because you are a chiropractor, right?
Yep.
I get personally a lot of hate on my Instagram from chiropractors that stem cells don't work. Just come get a chiropractic adjustment. I personally had a bad experience with a chiropractor. Not that all chiropractors are bad, but when I ruptured my S1L5 and it went into my spinal cord, and I was scared to get back surgery like everybody is. And so I was going to see this chiropractor who supposedly worked with all these pro athletes and stuff. And every time he would adjust me, I'd be worse. Yep. And he was like, hey, you just need to, keep doing it. And I went to 4 surgeons before I picked the one that did surgery on me. It was only because he was the only guy that pulled out my MRI and my radiologist report and would explain to me what happened. And, he's showing me on my S1L5, you can see it's like a giant triangle wedge going into my spinal cord. Right. He goes, well, just so you know, every time he's pushing on this disc, more of this might be squirting into your spinal cord, and you don't have a lot left. If it goes all the way across here, he's like, you might lose, use of everything below the waist, including your little boy, you know? And I was like, whoa, you know?
Yeah.
And he asked me, do you ever look at your MRI? And I'm like, no. He's like, do you ever take an x-ray? And I was like, no, you know? And I was just like, so after then I got a little bit leery of some chiropractors.
No, I think it's like you said,
you know,
chiropractic, physical therapy, you know, entrepreneur, whatever, lawyer. There's good ones out there. There's bad ones out there. Of course,
good stem cells, bad stuff.
Yeah.
I got a place just south of here in Mexico that's been stole my video and has stolen pictures and stuff off of our website. And I've had 2 or 3 people like, hey, is this you guys? You know what I mean? I'm like, nope, I don't know what they're doing.
Wow.
And their prices are so low. I'm like, I couldn't even buy the reagents to do our stem cells, you know, for that price. I don't know what you're getting, you know. Right. So buyer beware,
yeah,
you know,
definitely.
Buyer beware. Cheap stem cells are scary to me, you know. So, well, I think it's great that my patients actually showed up at your place to do physical therapy, because I preach it every single group that comes here. And, you know, I've got a guy upstairs who's a return with you that was on the PMF machine.
Yeah.
And he's like, hey, my elbows feel great, but my knees still feel weak. And the first question I asked him, I was like, well, did you go to physical therapy? No.
Right.
You know?
Yep.
And so I'm not a doctor or anything like that, but I know from my physical therapy, you got to rebalance your muscles, right? You got to get the ones that have atrophy. Explain to people, you know, so I have some other patients, why that's so important in the healing process, that the stem cells aren't the magic end all, you know?
Yeah, I think, you know, a lot of times with whatever the injury might be, whether it's spinal, you know, disc or a facet or something like that in a joint, or if it's an extremity like a knee, arthritis or something, there's chances are, right, there's high probability that some sort of compensation is what originally led to that injury to begin with. In the absence of direct trauma, like someone skiing down a mountain and they blow their ACL, whatever, there's probably some sort of poor movement pattern that involves muscle imbalance, or, you know, weakness on one side or weakness somewhere along the chain. And that's where PT and you know, a good chiropractor, someone that knows the ins and outs of that kind of thing too and does rehab, can really be of help. I mean, for me, I'll use myself as an example. After I got the stem cells and gave my body the necessary time to rest and you know, recover from the injection, etc., you know, I went to my wonderful team at the office, and I was like, all right, I need to kind of fix what's going on, find the weaknesses, identify them, and address them appropriately. So even with my turf toe injury and the arthritis that I was suffering in at that joint, I still had to follow up, to your point, and do the necessary rehab, you know, to address those weaknesses throughout the chain.
Yeah.
So.
Well, that's interesting, because what I didn't think of and what I didn't know was that there might have been those muscular imbalances before that led to the injury or led to the pain. I've always thought about it, like for myself, after I broke my back, I was so hunched forward that my core muscles got really strong because they were holding more of my body weight. And even like a month and a half after stem cells, I could stand up straight, but my low back would get so tired. And that's when I started to do physical therapy. And I noticed within a couple weeks, I was like, oh yeah, this is working. This is really excellent. So interesting to know. I can share that now with people that, hey, it might have been even before you got in this accident that you were causing that.
And
but
to your point, I mean, for all the listeners out there, I mean, after the stem cells, and like I said, there's the doctors help you with determining how long you should wait to begin such rehab and physical therapy, but you can't emphasize it enough. Like you said, it's just necessary, and it's going to make what you guys do down here even better for that person.
Yeah, it surprises me. It's like you spend your most valuable thing down here, right? Your time. You're here with me for a week, and you're spending some money. It's not cheap. And then to not like follow through and to just go, you know, it's not you got to go every day. Go once a week, once every 2 weeks, get some exercises.
Right.
You know, that's what I did. And you know, it surprises me, like that guy today. Oh, my knees still feel weak. Oh, did you do any physical therapy? No.
That's
you
right.
know, well, how are they going to get strong? You
Yeah.
know, like what you think sitting on the couch, all of a sudden the stem cells are going to grow your muscles stronger, you know,
Right.
tighten stuff up, you know. So, well, how about any advice on finding a good physical therapist or chiropractor? How do you know if they're good or bad?
Yeah. Well, first I'll say if you're
Just
in,
go to you.
If you're in
but
the Nashville
if you're in the
area,
Nashville area, if you're in the Nashville area,
yeah, come to
plug the
Resilience.
website. Yeah, go ahead.
Myself and like I said, my team. I can't say enough about them. I feel like my PTs are the best.
I've heard
they really are.
great stuff from Eli and a couple other people that have been the way that you combine the weight training and everything. And I got to come see your facility. I heard it say.
Yeah, I think I mean we have a special, some whatever you want to call it, special sauces. I think that kind of make us stand out. And one, we just have great people.
Yeah.
I mean, the therapists that I have, the opportunity I'm so blessed to work with, they're just great people. So they're personable, they get along with the person. And then two, we do our best to empower that person, that patient, not only with encouraging words, but of course with the know-how that they can do things on their own and they don't need to become fully dependent on, in-person therapy with us. And then the third thing is I just think we're hungry in an innovative kind of stay on the cusp of what's new and what's working type of way. So we do utilize different therapies in our office, but at the same time we show a lot of discretion on which patients are going to get what, and of course in their best interest, but we're just not just throwing something on the wall and seeing if it sticks. I mean, there's a reason behind everything we do. And then lastly, our therapy is all one-on-one. So, a lot of times people will go to a physical therapy clinic, and in some cases even a chiropractic clinic, and there'll be one of, 6 people working with a therapist at any particular hour. So they're not getting a whole lot of attention. Most importantly, they're not being watched to make sure that they're actually doing the therapy correctly. Right. And then, it allows us to kind of audible too when we have one-on-one. If someone's showing proficiency, doing a certain movement, we can progress them accordingly. Conversely, we can always regress somebody if they're really struggling to do an exercise properly. Yeah. So
I love that. After I broke my back and had back surgery, 2 years of physical therapy before I could kind of really get right again. And I can't even tell you, I'm at 20 different physical therapists. And it was just like that. There would be like 4 of us in a time, and the person would move from one person. Okay, you do this for a little while, or
right,
and then stand on one leg. I'll be back.
Yeah, I mean, I get, and your experience sounds rather typical. Yeah, especially the exercises. There's so many different ways to get people to move and load people. It doesn't it's not the cookie cutter old school kind of stuff. Yeah, some people start there, but we try to progress people as quickly as we can into doing some things that they probably have never been exposed to before. Yeah.
So what I'm hearing you say is find a place that does one-on-one for you. Yeah. And find somebody that is going to empower you and really help you move forward through the physical therapy.
That's it. That's the summary. Okay. Yeah.
And if you're in Nashville,
those are the 2 things I'd look for. Yeah.
If you're in Nashville, go to what website?
It's resilienthp.com. So
okay, resilienthp.com. I mean, it seems like I have a lot of patients in Nashville, so we might as well send them over to you. For sure. That's really good information, man. It really frustrates me. It happens pretty much every week. Somebody comes back, like you're here for you. Or what month are you on for your return?
Mine is 7.
You're on 7 months? Okay, so you're probably supposed to have been here in 6, but it got pushed out or something.
It got pushed out a little bit.
Yeah, so I mean, that's the cool part is just I get to see everybody, well, most everybody. Again, some people are doing so good, they don't come back, especially if they're from far away. Although we have 2 people from, I think, somewhere in Europe that came all the way back for theirs, this week. Doing theirs and see the MRIs and see what's going on. Sometimes the MRIs show nothing, but people still feel great. Mm-hmm. Sometimes people aren't feeling too great yet, but it's showing that there's some stuff going on the MRI and stuff is growing back. So it's interesting science to figure out. But we love just getting all that data. It's so nice to be just right here outside of San Diego so that people can just come over and You know, we want to prove we got the best stem cells. And
Yeah.
that's the only way to do it. I
Yeah.
got to have the same MRI machine, the same radiologist,
Yeah.
and be able to publish that data out. Yeah. So even on your foot, you did a bunch of
did a bunch of
therapy.
rehab. Like I said, just working on everything up the chain from the foot as well. So
That's
the
really
changes
cool.
for me have been
Well, what were the changes?
remarkable.
What was it like?
Yeah, I thought you might want to hear about
Sure.
it.
Yeah. I like
So-
talking about physical therapy, so I got off topic.
As I said earlier, for me, it kind of reached that tipping point late in the year last year. I was like, all right, I got to do something. So my symptoms included I wasn't able to load the joint at all. So imagine, trying to, the obvious ones are like run and jump. But even if I was told to do like a reverse lunge with my right foot, the side that the injury's on, where I step back with my right foot, I couldn't do it without obviously favoring the outside of my foot. So I'd kind of roll toward the pinky side of my foot. Or if I wanted to like push a sled down the turf, same thing. The only way I could do it would be to roll to the outside of my foot. And while of course I'm avoiding some discomfort and any sort of flare up, I'm also not doing the rest of my body any favors, right, by compensating. So that kind of gives you an idea of where I was at physically. Now, 7 months ago, I got the injection, like you said. And for the past, I'd say 3 months, it's felt better. It felt better at month 1. But when I reached the 4-month mark, that's when I was like, man, my foot is really doing well. It has progressively gotten better for the last 4 months. And then at month 5, I felt even better. Month 6, I felt even better. So now I'm able to load it. I'm able to push a sled, off that big toe. I'm able to reverse lunge. I'm able to even run a little bit. I've done a couple competitions that involve, relatively small distances.
What's a small distance?
Like one competition included a mile of running.
Okay.
But prior to the stem cells, I wouldn't have been able to do that.
Right.
I have a weekly thing I like to do on Sundays. I go up to a local high school and I go on a soccer field either with a buddy of mine or a lot of times my son comes over with me. And we run strides, sort of not all out sprints, but close to max effort of various distances between, 10 to 100 yards at a time. And now I'm doing that, believe it or not, barefooted. Barefooted in the grass.
Wow.
So that gives you an idea of how much better my foot has done.
Sounds a lot better.
Yeah.
That's awesome.
Yeah, you got a happy one here. That was great.
It's when you lose something like that, I couldn't run for 10 years.
Yeah.
And when you get something like that back, there's a little shorter time, but you're like, damn, I thought I'd never do this again.
Yeah. It gives you a whole new perspective, just being grateful for
Health.
Yeah.
I'm glad you're running again. Get to spend some time with the kid. That's awesome.
Yeah. No, it's great to.
Are you faster than him or is he faster than you?
He's 15 and it's close.
It's close. He's catching up.
Yeah, he's pretty athletic kid. So
man. Well, that's awesome, man. Thanks for coming on the podcast. Anything else you want to share? Anything you want to talk about? I just was excited to meet you.
Yeah, no, I appreciate you having me, and thanks to you and Ed and your entire CPI team.
You didn't get beheaded coming over here.
No.
Kidnappings.
I feel you guys take care of everybody.
Yeah.
I mean,
it's crazy how scary people think it's down here. I'm like, scared of what?
Yeah. I mean, I feel safe the entire time I'm here.
Yeah.
It's transportation that you guys provide, and it's all first class.
Yeah.
So thank you.
It's not as crazy as people think it is down here by any. And we're so close. I mean, you can see San Diego right out the window.
Yeah.
That's why I always tell people. I go, listen, if you got your passport with you, you can literally walk to San Diego.
Right.
6 minutes.
Yeah.
You're right there. Wave to the little people and hey, let me over the fence. Type of thing, and they'll let you right in. Well, cool. Right on. Do you have a social, Instagram, anything else you want to promote on here?
Like I said, our website is resilienthp.com. Social for me is just Josh Renkens. I'm basically on Instagram a little bit.
Spell it out for people.
We got Resilient HP on Instagram and Facebook as well. So
okay, awesome, buddy. Well, thanks for coming back down. I guess we'll see you in like another 6 months, right?
Sounds good.
See how those stem cells are doing. Cool. Thanks, everybody.